Thank you so much for having me. I'm so excited to join the call. I've been wanting to connect with folks from the American Planning Association and Plan4Health for forever. So I'm really excited about this. So Elizabeth, will I control the slides from here on?
Yes, yep, the arrows are just in the lower left-hand side of the screen there. Okay,
great. So hi, everyone. As Elizabeth said, my name is Kristen Cooksey Stowers. I'm at the Food Policy Center for Food Policy and Obesity. Today I'm presenting on zoning out fast food, predicted health impacts, and increasing public support. So just to provide a brief overview of my talk today, I will cover some background information on health zoning, and then I'll go into the potential impact of zoning out fast food retail establishments with some reference to a paper I have under review on food slums, public opinion, and mobilizing communities to introduce fast food retail zoning restrictions, and sort of, again, making mention of a second paper, working paper I have on framing the discussion to increase public support of zoning restrictions on fast food. Then I'll go into the broader implications for public health, next steps, and then I'll open it up for Q&A. So in 2012, the Institute of Medicine Committee on Accelerating Progress in Obesity Prevention called for a systems approach in thinking about obesity. So health zoning was in fact listed as a plausible policy option in their report. However, there were a few limitations that I aim to address in my research. So one, in terms of gaps, the report lacks emphasis on fast food zoning restrictions versus zoning changes related to grocery stores, farmers markets, etc. It also lacks evidence on potential barriers to implementing zoning restrictions on fast food, such as generating public support. And it ignores how the process of altering zoning laws affecting the food environment varies in communities of color and what this might mean for in regards to health inequities. So briefly, here's the systems approach that I just made mention of, promoted by the Institute of Medicine. And as the figure reflects, the food and beverage environment is a key component to this systems approach, and this is the domain of my research in particular. So now I think it would be helpful to provide some background information for a few key concepts. Most of you on the call probably know what zoning is in general, but just to go over, it's a regulatory tool that local governments can use to shape land use and to determine what can and can't be built on land. Health zoning in particular is a term that's been used to reference ordinances that are meant to modify the built environment to protect public health and within legal constraints. And interestingly, historically, public health has been the best reason for zoning, but we see so little of it with regards to altering food environments as a prevention strategy of obesity and other diet-related health diseases. So in general, why might health zoning work? So the idea is that zoning would improve obesity and diet-related health illnesses by increasing access to grocery stores, farmers markets, and more health-promoting retailers, while simultaneously restricting access to unhealthy food outlets like fast food, thus having people improve their diets because they improve the default food environment, and thus prevalence of obesity and other diet-related illnesses would decrease. So just to demonstrate the timeliness of the topic of fast food zoning restrictions, here's a quote from the article. I'll just share a quote from an article published in The Atlantic last year. So the author writes, in Calistoga, California, for example, fast food chains were forbidden in the spirit of preserving the hamlet small-town charm. But the South LA ban was unprecedented in that it was the first to connect a policy to the obesity epidemic. Unless the tenor of the conversation about obesity gets a little less paternalistic, it is going to be a challenge to get anyone to the table. So here's a summary table from my working paper on fast food zoning restrictions. So this table reflects 77 communities that have zoned out fast food retail, but or have some zoning restrictions targeting fast food establishments. But as you can see, the discussion or the motivation behind making this policy change was framed around different motivations. So at the top, there's South LA as the example of public health motivation, but their to date zoning restrictions on fast food have largely been framed as a way to improve the local aesthetic, to preserve small-town charm, to address traffic congestion, etc. So here's, I'll just give a slight overview of the paper, my Food Swamps paper, and it's called Food Swamps Predict Obesity Rates Better Than Food Deserts in the United States. So yeah, I'll just briefly go over some of the evidence on the impact of fast food zoning restrictions. So these studies use rigorous experimental or quasi-experimental design to really get the causal impact of the food environment on diet-related health. So one study was a 15-year longitudinal study of over 5,000 U.S. adults, and they found evidence supporting zoning restrictions on fast food within 3 kilometers of low-income residents, and they found that it had it would lower fast food consumption, but that greater supermarket availability did not improve diet quality or fruits and vegetable consumption. And then a couple papers by Chen also, she used some policy simulations, and her results showed that a zoning restriction policy would reducing the density of fast food restaurants would lower BMI, and also prioritizing sort of economically disadvantaged communities with higher BMI prevalence would be an effective way to lower, effective way to improve health outcomes, with BMI being an example. And then a food swap paper that I have under review was a quasi-experimental study where it made use of highway exits in proximity to fast food to examine the impact of food deserts and food swamps on obesity. And my findings show that zoning interventions targeting fast food swamps would have a stronger impact on the obesity prevalence than those targeting food deserts. So an important question has been, are food swamps and food deserts the same places? And so here is just a map of food swamps based on one of the measures that I've used, capturing the relative balance between fast food and corner stores to healthier alternatives such as grocery stores, supermarkets, etc. So on the left, these are county-level food swamps. Yellow, orange, and red captures counties where fast food and corner stores outnumber grocery stores from about 5 to 26. And on the right, the yellow, orange, and red reflects counties where the percent of low-income adults with low access to grocery stores ranges from 6 to 72%. And so I just think spatially you can see there's sort of a different clustering. There's a very clustering of food swamps relative to food deserts, suggesting that they're separate phenomenon. And you can see it's sort of faint, but the black line on the food swamp map to your left is showing highway exits, and you can see that highway exits are running straight through the most sort of food swamped communities. So just in terms of key findings from my first study, food swamps do appear to be a separate phenomenon from food deserts, and they may play an even larger role in obesity prevalence. And then in terms of zoning restrictions targeting food, some stratification analysis I did suggested that zoning restrictions on fast food targeting outlets that made unhealthy eating easier the more you drive would have a higher impact. So for example, we might think about zoning policies targeting drive-throughs or gas stations with food, for example. And then the other interesting thing I found in that study was that income inequality, sort of measured by the Gini coefficient, does not explain away the food swamp phenomenon. So we really have a built environment planning issues to explore rather than an issue of just socioeconomic status. So just to now go into the second study, specifically on the question of how framing influences public opinion of land use regulations restricting fast food restaurants. So this study and hypothesis stems from 3 core streams of literature that I look at. So first, the framing literature from political science. So just to define what framing is. So a frame means to select some aspects of perceived reality and to make it more salient in communicating text. And doing this can promote a particular problem definition, causal interpretation, moral evaluation, and even treatment recommendation to a community. And scholars have pointed to the question of who the intended audience of framing messages are and how certain messages might resonate with certain groups differently than others. And so I think the point here is that how we frame the discussion around zoning restrictions matters for health communication because they affect public attitude and even behavior of audience, in our case being the community. And then another key point here is that research on gain-loss framing suggests people respond more positively when exposed to advantages rather than disadvantages, even though the actual information is the same. So an example there would be, sort of 70 lives saved versus 30 deaths, for example. The statistics of it remains the same, but the information is framed in terms of gains. The other stream of literature comes from the socio-ecological models of obesity literature. And so I'll just share one of my favorite quotes, which is what is seen, asked, and heard depends on who is looking and listening. So in this paper, the authors are calling for considering cultural processes, historical and social context, in addition to physical environment as important determinants of community-level obesity. And then finally, environmental justice and health equity comes into play when we think about zoning out fast food retailers. So to define environmental justice, some key concepts come into play here. So public policies that are based on mutual respect and justice for all people, the right to ethical, balanced, and responsible uses of land, universal protection from exposure to toxic hazardous food that threatens the fundamental right to clean food, and the right to participate as equal partners at every level of decision making. So in terms of health equity, scholars argue that health restricting facilities like fast food restaurants are deliberately located in low-income or minority neighborhoods because they are perceived to be the path of least political resistance. So this is just something we might think about as we discuss zoning out fast food ordinances. And so, in terms of where we are today in terms of the evidence, so far we know when zoning restrictions targeting fast food is framed as a nutrition intervention, it decreases the likelihood that it's being passed. But yet this is the only framing that has been used in Black neighborhoods, for example. Little is known about public attitude towards zoning restrictions on fast food. We saw some pushback in South LA, but there's been no assessment of public support for this to date. And so there's no causal evidence in particular. This will be the first study to examine sort of an experimental evidence on the topic. So in terms of what motivated this study, I was motivated by the discourse around the South LA fast food ban and some content analysis research coming out of media coverage showing that nutrition frames decrease the chances that these zoning ordinances would pass. And so I'm aiming to assess whether nutrition frames could be bundled with some non-nutritional benefits to improve public opinion. And then the other thing that I'm getting at here is the issue of race equity. So one question I had in this study was, can race equity frames emphasizing gains mitigate the effects of race equity frames extenuating loss among Black respondents? So just briefly, in terms of methodology, just to sort of get at this question that I outlined here, I ran an online survey experiment, sort of randomly assigning people to different vignettes and their exposure to a different frame about why we would introduce a zoning restriction on fast food. I used a between-subject experimental design. I also used 2 different samples, so I had a very large sample size combined of over 5,000 respondents. And then this is just the general study design. So respondents were randomly assigned to one of these 7 conditions. They were sort of giving a vignette that a zoning restriction was going to be introduced in their community, and then they were randomly assigned to why that, what the benefit of that policy change would be. So there was a control where there was no frame. The nutrition frame primed people with a message about general adult diet and nutrition. The child nutrition highlighted benefits to children's diets. The economy frame stressed benefits to the local economy in addition to nutrition. The addictive frame explained that zoning efforts would lower the availability of addictive foods. And then the race equity frame was inspired by, the qualitative evidence suggesting that when zoning initiatives were introduced in minority neighborhoods, they were being framed in terms of losses so negative impact, so issues of unworthiness and government intrusion. For instance, one quote describes the government treating African Americans as children and taking cheeseburgers right out of their hand in response to the idea of a zoning restriction on fast food. So instead, I actually tested a race equity frame stressing gains from this kind of intervention and thinking more in terms of a equitable food system and sort of introducing some balance to the food environment. And then the final frame stressed the improved local aesthetic and traffic conditions as a benefit in addition to nutrition. So again, I think these non-nutrition benefits were bundled with nutrition benefits, if you will, to test if that had a marginal benefit on each individual support of these different policy changes. So now I'll get into the specific policy changes that I asked sort of these over 5,000 U.S. adults about. So each person was asked to indicate to what extent they favored or opposed the following zoning changes. So one was quotas and bans on fast food establishments. Another was conditional use permits for retailers that allocate a certain amount of shelf space to healthier options. The third was requiring fast food outlets to locate a minimum distance from schools and playgrounds, and then prohibiting the distribution of toys and promotional games, limiting vehicle access to fast food retail, again, like drive-thrus, or offering incentives like tax breaks and subsidies to incentivize fast casual establishments, which are perceived, and so there's some preliminary evidence showing that just with the food quality and additional sort of produce introduced at fast casual establishments, that might be a better, a relatively better option than sort of your McDonald's and Burger King, for example. So yeah, this is just to give a snapshot of who was in the sample. I set some benchmarks to make sure that we had sort of half male, half female. I did an oversample of African Americans and Hispanics. I was able to capture sort of a lower educated population, sort of setting a benchmark at 29% high school as the highest level of educational attainment. And then in terms of addressing sort of party affiliation, I set a benchmark for 26% Republican. And so, yeah, so the gist of this here was just comparing the respondents of my second sample of over 3,000 persons against the statistics for the national data. And so overall, the respondents that answered this survey and were involved in this experiment were representative of U.S. adults. So for the next two slides, I want to just share some results from the public opinion. Two of the public opinion questions I included in this instrument. Respondents were asked, how do you describe a fast food restaurant? And so 76 to 84% described quick service, a drive-through, and a national brand is how they would define it. And this piece is important because part of the challenge with introducing the zoning restrictions to date has been the definition of fast food and identifying which retailers would actually apply. This was a key barrier in the South LA case study. For the second public opinion question, I think another major challenge I've identified in my research is, again, this concern about community buy-in and public support. Again, a key motivation of me launching this study in the beginning, sort of taking it back to the South LA case study, the sort of the community public opinion of this intervention was low, and I perceive this as being an issue of the health communication and the framing of the discussion. And so reflected in this graph, about 68% of respondents said fast food restaurants contribute quite a bit or a great deal to growing rates of obesity in the U.S. So this sort of contradicts some of the follow-up discussion that sort of has come out of South LA, that people sort of don't agree with these kind of interventions because they don't see fast food as the problem. And so I have found the opposite. So now transitioning back to the results of the framing experiment, again, how can we frame the discussion about zoning restrictions targeting fast food? So here's a summary table reflecting the increased likelihood of the individual support of each policy and by race. And so you can see the columns. One includes the full sample of respondents. And then again, because I'm interested in sort of these issues of equity, I did some stratifying of the white subsample and then the black subsample. And I categorize the findings based on these broader health zoning categories in order to look for trends. So conditional zoning is, which many of you on the call are probably already aware of, but I'll just run through quickly. For conditional zoning, local governments identify admissible or prohibited uses of the land. Youth-related is self-explanatory. For incentive zoning, this would include incentives for developers like tax credits, tax exemptions, low-cost loans, for example. And then for performance zoning involves setting standards concentrating on the outcomes of land use. And as the blue stars reflect, the equity frame appears to be an effective message frame for non-youth-related zoning restrictions. You can sort of see the blue star coming up across categories. And so just to give an idea of effect size, in the full sample, the nutrition bundled with equity increased the likelihood of support by 7% versus the nutrition only, it improved it by 3% relative to the control group. So thinking of going back to the original 3 questions I showed earlier, nutrition and increasing equity in the food system was particularly effective across policy categories. And this is consistent with some work that I've seen in environmental justice, and it's showing that these environmental injustice frames have been effective at mobilizing the community around around environmental issues. And so my findings sort of expand this notion to the food environment. Black respondents had a strong positive response to equity gains frames for vehicle access restrictions and fast casual restaurant incentives. But I think what was really interesting was that African American respondents were not the only group to respond positively to this equity frame about increasing sort of equity in the food system in the minority neighborhood. Sort of everyone, it was sort of a universal support for this. And then also I found evidence supporting the idea of differential framing effects by race. So I guess now going to just broader health implications, the so what factor, if you will. If we're concerned about health inequities such as disparities in obesity prevalence, we can continue to have sort of effective marketing strategies for community engagement and mobilization kept from socially disadvantaged communities. We should be aiming for more inclusive land use planning processes for those most affected, including those decisions shaping the food environment. And so regardless of how it was framed, sort of going back to the impact of these policies, the rigorous studies using experimental and quasi-experimental approaches find evidence supporting that zone restrictions on fast food might work to improve diet and diet-related health outcomes like obesity. And I would argue that these should be done in conjunction with healthy food access interventions. So I'm not arguing to sort of do away with those, but just to sort of do more to address the unhealthy side of the equation. And so in terms of practical, sort of this in an applied sense, zoning advocates interested in fast food zoning restrictions should employ targeted health marketing campaigns for fast food zoning restrictions. So carefully considering which type of policy we're talking about and then the racial composition of the community. And so health advocates promoting conditional incentive or performance zoning in a mixed race or predominantly white or black neighborhood, the nutrition and equity frame was across the board. There's a different trend, though, with the youth-related health zone activity. So again, sort of having fast food, having minimum distance requirements of fast food by school, there was a different trend here. So for a white or mixed race neighborhood, a nutrition or addictive properties frame might be the more effective messaging tactic. For a black community, a youth-related sort of, again, minimum distance from a playground or school, child nutrition, my results suggest that child nutrition framing would be more effective. And so just in terms of next steps of this work, I'm interested in delving more into my Hispanic subsample, sort of conducting a field experiment, testing an intervention like this to improve support for zoning interventions, and then, conducting focus groups or qualitative studies in order to better explore these mechanisms, linking racial identity and the framing effects of zoning restrictions on fast food. So in other words, why was this equity frame so effective across the board? And so now I'll just open it up to questions, and again, very interested and open to working together.
Great. Thank you so much, Kristen. That was fabulous. Very action-packed presentation. It is just about 12:30, but we will definitely stay on the line and chat a bit more. If folks are interested in asking Kristen questions directly, you're welcome to unmute your line or chat in the box there on the right-hand side of the screen. I was wondering, Kristen, if you could recommend resources for folks who do want to read up a bit more, not only about the framing of these issues, which I think is really important and fabulous that you're doing this research, but also maybe just to find some sample zoning language or ordinances. Do you have kind of a go-to resource that you rely on?
Yes, I have several. I have several resources on that. I have them sort of compiled. So if I just put up my contact information, I'm happy to share. I think that I shared it before with you, Elizabeth, I think, or maybe that was just regarding the report that was just recently that came out. But yeah, if folks are interested in references, I do have have compiled some sample ordinances, and I'm happy to discuss more if you'd like to email me for them.
Great. And then does your policy center, the RUD Policy Center, is that also a great place for folks to go just to check out your work and others, or do you have other recommendations for resources like that?
Well, I think sort of Change Lab is a great organization for looking at zoning work. Zoning is not a sort of big topic area for RUD just yet. This work is sort of expanding from my dissertation. It's definitely an area that I hope to expand here. But yeah, I would definitely recommend Change Lab, and for folks to feel free to call and email me if they're interested in more. I can certainly sort of direct to more resources on studies and other organizations working on this.
Fabulous. Okay. Great. We do have a few questions here. Just in terms of logistics, we will post the recording of this webinar and a PDF version of these slides on the Plan4Health website, and I can go ahead and send you a link directly, Chad, if you'd like, and if other folks would like a copy sent directly, my email address is here. And then we do have a couple of questions. One from Emily about accessing the map. That was a really fabulous map you shared, kind of helping us think through the difference between food swamps and food deserts. Is that something you developed, or is there a way folks could get to that map?
Yes, that's the map that I developed from my food swamps paper. Again, a key part of that paper was identifying food swamps at the county level and looking how sort of spatial patterning of the food swamps sort of matched up to food deserts, because part of the discussion has been I think people often conflate the two, that you're sort of assuming that they're the same phenomenon, but they're, I think from the map, I put the map up to show that they look like they're a different, that there could be some overlap, but they seem to be sort of a different trend geographically. So that paper, again, the paper is under review, so that map will be in that paper.
Great, okay. So Emily, you're welcome to stay in touch, and we'll pass along the paper as soon as it's published, because that is certainly a fabulous resource for folks. We do have a
Emily,
question
feel free to reach out.
Great, and it looks like we have a question from Catherine as well. Have you looked at an economic framework such as minimum wage jobs found in fast food restaurants versus better paying jobs and other land uses, or potentially zoning out unhealthy, locally owned restaurants?
So yes, I've considered the economics of, sort of the food environment and this issue of fast food and substitution quite in depth. The paper is not directly looking at issues of minimum wage, but it's sort of in the paper, the food swamp paper. But the reason why I've included sort of the fast casual establishments is just to assess whether people see this as a better option. Is sort of motivated by some of the studies or some of the qualitative work coming out, suggesting that people are concerned about that fast food jobs being a primary employer in certain neighborhoods, and so in terms of like places like Prince George County in Maryland, rather than sort of doing away with fast food altogether, because they realized that certain parts of their population would sort of in fact be employed, and that would be a huge economic impact. They were interested in looking at bringing in fast casual establishments as a relatively better option. Sort of, for example, Panera Bread, or these are what constitutes fast casual, where there's sort of you can see the food being made. The food is higher quality, and there's more sort of healthier options, produce incorporated into the menu. So this is sort of characteristics of the fast casual. So the interest in fast casual is in part related to these issues of economics, and which shows that those employers actually tend to pay better than your McDonald's and Burger King.
Interesting. Okay. Well, great. Well, thank you again, Kristen, for being on the line today and for sharing your work. It was really, really fabulous and gave us a lot to think about. Certainly the framing component, I think, is so critical and something that has certainly come up in all of the Plan4Health projects as we really push for healthier changes. Well, and thank you all for attending this afternoon. We'll stay on the line for just a minute or two if anyone has any last-minute thoughts or questions. Otherwise, certainly look for a recording of the webinar and a copy of the slides on the Plan4Health website. And you're also welcome to email me directly if you have any questions or concerns. Thank you so much.
Thank you, everyone. Thank you for having me. And do feel free to reach out.